My name is Luigi Biasco, and I'm an interventional cardiologist from Italy, and I have the privilege to interview Dr. Suzanne Arnold from the University of Missouri, Kansas City, which is going to present a TCT as a light-breaking trial, a sub-analysis of the TRILUMINATE trial focusing on health status of patients treated by tricuspid-TEER. So welcome, Suzanne.
Great. Thank you. I appreciate the opportunity to speak.
Can you please summarize the results of your sub-study?
Great. Yeah, so I thought that, we thought this was a really important thing to look at because the primary trial did not see a benefit in terms of death or rehospitalization, but did see an improvement in health status. And so our analysis was really looking at a deeper dive into the magnitude, the duration of health status improvement after T-TEER. And we found that that patients who were treated with T-TEER had a significant benefit in terms of health status, quality of life that was evident by 1 month and sustained through 1 year. That's the primary results.
Okay. Is there a direct correlation between a residual tricuspid regurgitation and following TriClip and the KCCQ score?
Yeah, we thought this was really important to look at because obviously the KCCQ is a patient-reported outcome, so it is open to bias, particularly in an open-label study. So we did an analysis where we looked at residual TR at 1 month and 1 year and concomitant change in KCCQ, and we did see a strong association between the two. So for every 1 grade reduction in tricuspid regurgitation, it was associated with about a 4-point increase in the KCCQ.
Okay, so the lower the tricuspid regurgitation, the better the health status of our patients.
Correct. Yes.
Which of the 7 domains of the KCCQ score was the most affected by tricuspid-TEER? What we can expect from the interventions?
Yeah, so I think that the results that we saw with tricuspid-TEER were actually very similar to what we have seen in mitral TEER as well. So it's the symptoms and the quality of life domains that are impacted the most. The physical limitations domain, which is a disease-specific physical limitations, is also impacted, but less so than symptoms and quality of life.
Okay, good. And then my last question, we are used to observe following a significant increase in health status, also a benefit in terms of mortality and reduction of hospitalization. In the co-op trial, we have seen an increase in the KCCQ score post-intervention by 12 points, and this was mirrored by a reduction in mortality and reduction on the risk of hospitalization. Why we do not see this same effect after tricuspid-TEER?
Yeah, so this was obviously a really important part of our study. One of the things that we did to kind of tease that out is we looked at patients after tricuspid-TEER, and at 1 month, the change in KCCQ versus subsequent heart failure, hospitalization, and mortality. And we found that the patients who improved at 1 month actually did have a significant reduction in the risk of mortality and heart failure hospitalization. And if you look at the strength of that association, it's actually very similar to what was seen after mitral TEER. It's very similar to what's seen after TAVR or even in patients who are medically managed. So if the KCCQ improves, those patients then do better. I think one of the issues with the tricuspid patients and why that didn't translate into the overall study in terms of heart failure, hospitalizations, and mortality, part of that I think is the event rate is slow. So if you look at patients who have tricuspid disease, they're not being frequently rehospitalized for heart failure hospitalizations like mitral patients are. And so that's one of the thoughts that maybe that's one of the reasons why we didn't see overall improvement. But certainly the people who did improve were more likely to do better in terms of clinical outcomes after a year.
Right. So still a lot of work to do.
Mm-hmm.
Thanks, Susan, for being with us. Congratulations for your late-breaking trial presentation.
Great. Thank you. I appreciate the opportunity.